Good afternoon, everyone, and welcome to this afternoon's Health Department briefing. I'd first like to thank all of those responsible for assisting in getting additional locations opened up for those wishing to take the COVID testing. We'll finally be able to have some really solid metrics to determine our exposure here in Central Illinois. Well, we all saw the governor's announcement last week that the shelter in place would be extended to the end of May with several modifications, and it sounds like that's still a moving target. But there's also been a lot of discussion about the necessity of the extension with no shortages of opinions on all sides of the issue. As you know, I've been generally supportive of the governor's approach to managing the pandemic in Illinois, especially in light of the fact that we don't have any models out there to help us navigate for the health safety of our state as well as the economic viability of our state. The governor has steadfastly used medical science metrics to help make decisions and done a good job to this point. In my opinion, the medical metrics and the economic metrics need to be looked at together. I don't want to hijack today's press conference today and lose focus on the public safety element and purpose of these briefings. I do want to use this time to say that it is time for the governor to specifically engage downstate leaders in a process to potentially allow communities that would qualify to begin safely opening their economies potentially well before the end of May. I'm also not saying that I have the plan. I will say that there are several mayors, business groups, and other leaders developing ideas of how this could potentially come together. And an example of this, to take the local politics out of it, I'm going to leave the media here with a copy of the report that was recently developed in Adams County in Western Illinois on this topic. And my understanding is that it's been sent to the governor. For the rest of the listening audience, I'll ask City Hall's IT folks to post a link to that on our website so you can take a look at it too. The Adams County information is probably not quite ready for implementation, but it shows you a lot of thought has gone into it. They probably need to connect the metrics with community testing. What's their ability to track and trace? And what's the capacity of their healthcare community if there's a surge at some point in the ramp-up process. Peoria's Economic Development Department has been working on this, as has the Greater Peoria EDC and others in the area. We can do this without jeopardizing our health and safety, and that should remain the number one objective. I have let our state elected officials know of my thoughts and urge them to facilitate these discussions with the governor sooner rather than later, and they're in agreement. Instead of getting into a lot of hypotheticals on how to measure and implement a regional process right here, I would just ask that we stay focused on the health department happenings right now. I'm glad to stay around after this is over and answer questions so it doesn't take away from what Monica and the other speakers have to say today. I would like to also, on behalf of Chairman Rand, Chairman Zimmerman, and Chairman Krug from Peoria, Tazewell, and Woodford counties, thank everyone for participating and engaging in this daily health briefing. And now, Monica Hendrickson.
Thank you, Mayor Ardis. We've been to get today's briefing with the to-date totals as of April 27th. Peoria County has 69 confirmed cases, Tazewell County has 37 confirmed cases, and Woodford County has 11 confirmed cases, bringing our total count to 117 for the Tri-County region. There are no new deaths to report. In regards to the hospital systems, OSF St. Francis Medical Center, Unity Point Health Methodist, Proctor & Pekin report 20 ICU beds in use, 9 for persons under investigation, and 11 for those with confirmed COVID. Currently, there are 34 non-ICU beds in use. In regards to the Peoria County specific data, of the 69 individuals, 33 have recovered, that's roughly about 48%, 20 are in home isolation, and 14 are hospitalized. Our gender breakdown is about 60% female to 40% male. We still have those three age range being the highest in terms of counts. Again, that's the 50 to 59, followed by 30 to 39 and 60 to 69. And in terms of racial demographics, 55% are white and 41% are black. I would again highlight the fact that we do have our GIS dashboard updated routinely with data to break down specific zip codes, as well as where confirmed testing is done, as well as where overall testing is done. Last Friday, you asked for some a little bit more specific data on one population specifically. Of the 69 cases in Peoria County, 38% are attached to some type of congregate living setting. Again, demonstrating how this is a high-risk population. In regards to Heartland Health Services, of the 69 confirmed cases in Peoria County, 10 were identified through the Heartland Health Services drive-through clinic. And in fact, on Saturday, even with the weather as it was, there was a total of 80 tests done, 39 at East Bluff and 41 at the Peoria City County Health Department. Sunday, Peoria City County Health Department was the only one that was operational and saw 88 tests completed. And as of 2:45 today, East Bluff had 102 tests and Carver Center had 50, focusing again on the importance of testing and what it can provide in a community. With that, Heartland has updated their hours for their drive-up or walk-in testing for COVID. So the Wisconsin site, or East Bluff, will be providing testing Monday through Fridays from 9 till 4. Peoria City County Health Department will be a site only on Saturday and Sundays from 10 until 2. And Peoria Park District, John Gwen Park, which opened today, will only be a Monday through Friday from 9 to 4. So again, the Heartland, Wisconsin, and the Gwen Park will be your Monday through Friday from 9 to 4, and the Peoria City County Health Department will be available on weekends from 10 until 2. I did want to take the opportunity to talk a little bit more about testing, especially about serological testing. We see a lot of agencies or organizations posting the availability to do this antibody testing. And I want to make it really clear when we talk about this testing that it's still very new, and we really would want to hesitate individuals to participate in it. There is currently, first of all, no CDC or Centers for Disease Control and Prevention guidelines on how to interpret these serological tests, which is really key. Likewise, when some post that they are FDA approved, there's actually two types of FDA approval going on right now. There's one that's called EUA, or Emergency Use Authorization. And right now there's about 7 that are these EUA approved. They are required, and they're very moderate and high complexity tests. So it's not just a general lab that can do it, but a very much certified lab that has to be able to provide this test. The ones that are saying that they're just FDA approved without that EUA listed to it, they were actually allowed to fast track into that process as part of the COVID response. And as such, they were automatically listed as these high complexity tests. They still need to go through stringent validation processes, meaning they haven't been validated. And these validation processes include things such as testing on accuracy, sensitivity, specificity, and then cross-reaction. So the best way to recognize this, and we talked about it when we were first started with this response, is coronaviruses are in our community. As part of just the natural viruses that we see, COVID-19 is a very new and novel one. No one has that immunity to it. So what's really concerning about these serological tests is that it won't tell you what I think people want to know, which is, am I immune? Those tests are not set to make that response to you. They even won't tell you whether or not necessarily that you have been exposed, because you can get cross-contamination or cross-reference to routine coronavirus. So while I know there's a lot of interest and a lot of people wanting a lot of answers, I really hesitate on looking at serological testing as something that you want or to demand. In fact, we just got off the phone with our healthcare providers, which include OSF St. Francis, Unity Point Health, and Heartland Health Service. None of those are looking at this as an option because of those concerns. It is better to understand what people are asking for, which is, am I immune? Will I get sick again? And there's actually a new paper out from the WHO that questions whether or not people will build up immunity for COVID-19. But these serological tests are being promoted out in our community. that are over $100 each is not necessarily what giving you the answers you're seeking. So again, be hesitant about that when you're looking at that. I'd like to introduce our next speaker, Pam Perrilles, who's Executive Director of CASA of the 10th Judicial Circuit.
Good afternoon. April is National Child Abuse Prevention Month, and our attention rightly turns to ways we can support children who have experienced abuse and neglect. For the past 12 years, the Youth Service Network Panel and Peoria County has partnered to bring this awareness to our community through Hands Around the Courthouse. Due to the shelter-in-place order, we were not able to come together and join hands and educate our community about the great need in our community, and to hear from our local judges and state's attorney about what they see in those courtrooms. But I'm here to tell you that as of today, Peoria County has 1,186 pending abuse and neglect cases. The last report I had from Tazewell County was over 600. That's a lot of kids in our backyard, and these children are our future. So we do feel it is so important that the community really understand this need. In this time of social distancing, we must all work to remain socially close to children. Child abuse and neglect is likely to rise in the face of this pandemic, as families are put to more experiences of financial and emotional stresses. It's really a difficult time. But with that, the reporting is going to be down. It doesn't mean that child abuse is not happening. So, children are no longer in the public eye. They are not at schools or daycare or in other locations where acting adults would be able to spot the signs of abuse. We should follow the CDC's guidelines on physical distancing, but remain socially close, especially to children who have experienced abuse and neglect. Everyday life has turned upside down. But for a child who has experienced abuse or neglect, this may be just another time of turmoil. Because of isolation, the lack of social connections, and potentially poor mental and emotional health. We all need to be hyper-vigilant about keeping kids safe during this difficult time. For children to thrive despite abuse or neglect, resilience is the key. The most common factor in developing resilience, according to the Harvard Center of the Developing Child, is having stable relationships with adults. Children who have been living in these situations can become accustomed to being overlooked. In fact, most children moved from their families for maltreatment have suffered from neglect opposed to abuse. So while we're educating people on abuse during April, we also want you to know that research at the Harvard Center for the Developing Child have pointed out that despite this, child neglect receives far less attention than abuse. Compared to the active abuse, chronic neglect has been found to be associated with a larger range of damage to children. Having experienced abuse or neglect can have lasting consequences on youth. The U.S. Children's Bureau has found that at age 17, more than 1/4 of youth in foster care have been referred to substance abuse treatment or counseling at some point. By age 21, 20% of youth who were in foster care at age 17 had been incarcerated prior to 2 years. 22% of former foster youth by age 21 have given birth or fathered a child. 42% have experienced homelessness at some point. All of these things really impact our community. And so it really takes a community to help these children through this time. We have great hope for these youth despite the long odds against them. At age 17, 94% of youth in foster care reported that they had a supportive adult in their life who they could rely on for advice or emotional support. Having a stable relationship with a supportive adult can help children do well even when they are faced with significant hardships. Removing children from an environment in which they experienced abuse or neglect does not guarantee positive outcomes for these children. They need quality, therapeutic care, and support to move through those emotional experiences and thrive. Keeping children safe by supporting families and reporting suspected abuse or neglect is everyone's responsibility. This is a call to action, not just to families or those who work with these families and children. Rather, it is a sounding alarm to the mail carrier, the delivery person, the grocery store clerk, the pastor, the drugstore cashier, the virtual teacher, the next door neighbor. Will you join in keeping a watchful eye on our children? Reporting is everyone's responsibility. It's up to us to make sure that children are safe. If you suspect child abuse and it's in immediate danger, call the police. Call 911. To report suspected abuse or neglect, contact DCFS hotline number at 1-800-358-5117. For information about preventing abuse, you can visit the website at Child Abuse America at preventchildabuse.org. For information on CASA program, on the effects of child abuse and neglect, you can visit the National CASA website. In the stressful time, we encourage parents and caregivers to reach out, and if they are struggling, if you are a parent or caregiver who needs support, contact the National Parents Helpline at 1-855-427-2736. Community members can make a better difference for these vulnerable children, and there's lots of ways in our community to get involved, even during this time. I know that CASA has gone to virtual training for volunteers, and there's a lot of things that people can do with other organizations within the Youth Service Network panel to make a huge impact on the children that we serve. Thank you.
We'll open up with questions for our speaker.
So, as you mentioned, we have to obviously keep in mind social distancing, but as in your call to action, the grocery store clerk, mail person, etc. But I guess, especially with the virtual learning, a lot of times teachers so often, being kind of those frontline workers for this cause. I guess, kind of what would you recommend everyday people, look out for, when they're on their walk in the neighborhood, that sort of thing?
Absolutely. So, one, if you see signs of abuse, then call and make a hotline call. The other things you can do is just support families. If you know that families are in a position to be struggling with the loss of work and income, those are the things that happen many times. Parents don't actually intend to abuse their children. It just becomes situational. It's the other stress factors that come into play. People who are not in the everyday realm of caring for children find themselves now, I'm home with children all the time, and so it is stressful for them. So providing resources to families, letting them know how they can cope with having children at home, how they can cope being a teacher now too, besides just a parent. I know that WTVP has wonderful resources on their website that, we direct our volunteers and our staff to those resources to pass on to families, about, understanding COVID-19, what kind of questions that children ask. So just educating them a little bit more about all the resources that are available. And for those neighbors who know that maybe somebody is struggling, just reaching out and calling them and saying, hey, how are you doing? How can I help you? It doesn't mean that it has to be foster kids. It's kids in our community. We don't want those kids coming into the system, right? So it's just everybody just taking that opportunity, even though we're doing the social distancing. It's more physical distancing, but being social. There's a lot of creative ways that people are finding that our world is changing. And hopefully it won't go back to the way it was before. When you need to find out information or know things, you can still find it out virtually. Our team has gone to a remote work plan. We realized how busy we were going to be over this past month. We went to make sure that we were able to advocate for kids. We went to a weekly call with all children and families, and our volunteers so that we could every week do a different strategy to find out a need, to get people to open up. And what we found was that families were welcoming to that. kids are, staff thought that the kids were going to lose that, that rapport that they had built with them. But what they were finding doing the video calls, kids were excited to get a call from someone. So a community member could just reach out and do that to families. Send things in the mail. Be that encourager. Helping people to have hope to get through this trying time is really what all of us need.
And what would you say to the person who might be afraid that because of the stay-at-home order, that if they make a call to, say, DCFS, that it won't get answered?
Well, I'm probably not the right person to answer that. DCFS would be in a better position. I know that they're down on staff as well, and we've had to make a lot of hotline calls this past month. And so, because we're mandated reporters, we can kind of move it up the chain a little bit and request to speak to a floor person, if not. But they've been pretty good about responding and making sure that kids are safe, because they still have to do that job even during this time.
You said that there were over 1,000 cases already, which is already a startling number.
Yes.
Have you guys seen an uptick recently, or is this more of a time where the cases kind of go unreported?
Well, right now, we don't have court, so everything has been postponed out. And now with the extension, it'll be interesting to see how we move forward with permanency for children, And because kids are not in the schools, the reporting is down. And what I hear, 50 to 60% less calls coming in. So it doesn't mean that the abuse is not happening, but it is a high number. And Peoria County has, for many years, had a high number. When you look at the per capita, we have more abuse and neglect cases than Cook County, which is sad. But, we've got great judges and stakeholders who are really working hard with the Administrative Office of Illinois Courts to improve that number locally. But the thing of it is, we have to keep kids safe, right?
Thank you.
Thank you.
Open up to questions for myself as well as the mayor.
Monica, at the governor's briefing today, Dr. Ezike talked about new symptoms that the CDC has detailed for this. Could you describe that for our local audience here, and then if those symptoms qualify as symptoms now for the Heartland sites?
It's a great question. So today at the briefing, they reported the new kind of symptoms that we're seeing as we're getting more cases and understanding kind of how this disease really operates. So we still have that fever, we still have the cough or the difficulty breathing and shortness of breath. But on top of that is chills or shaking based on chills, muscle aches, headaches, sore throat, as well as this new loss of taste or smell. And so all of those, along with what we're seeing as the traditional ones, are all symptoms that Heartland Health Services, as part of their drive-through clinic, would consider a symptom. As well as I wanted to kind of also clarify a little bit about testing guidelines. So in regards to testing as it expands, it is now available for people who have COVID-like symptoms, which includes, again, that cough, shortness of breath, fever, difficulty breathing, along with the chills, muscle aches, headaches, the loss of taste and smell, or have a risk factor such as know someone or been in contact with someone that's confirmed as a COVID, or have a compromised immune system. That testing capacity is available. It is also available for those that with or without symptoms that are healthcare workers. So that includes individuals working in nursing homes as well as long-term care facilities. Those that work in correctional facilities such as jails and prisons, our first responders, as well as critical infrastructure. So they can still come in and get tested regardless of symptoms for those four groups. But again, we recognize the fact that if you have symptoms, the more your viral load is, the more stronger your test results will be, because it will have enough to say a yes, no. But understanding that those four groups, with or without symptoms, are so key to how we are able to respond and recover, we want to make sure that we're opening up testing regardless of symptoms for them.
No, last week you said, and you even reiterated today, that you should have symptoms unless you fall in a certain group or category. I know last week you also said if you did show up to the testing sites and you didn't have symptoms, you wouldn't turn them away. I want to know, do you think those two statements coincide? Do you think that people could just come regardless, because you've already said that you won't turn them away? And is that good because we don't have as much testing as we want?
So the question being, would we turn away individuals or kind of understand their symptoms based on those guidelines? I think I want to reiterate the fact that as this has progressed and the state has expanded testing, I mean, the first testing was coming out in February, and then it ramped up in March, and now we're at a point where we are able to provide 150 tests, 300 for both sites in totality, every single day, that we're no longer having to extremely prioritize testing. So I think as testing expands, more people have the ability to utilize that testing. At the same time, a lot of us have symptoms. I suffer from allergies. I sometimes will get a sore throat and think, oh, that's just allergies. But in this time, when you have this virus also spreading through the community, don't think of this as you self-diagnosing yourself. If you feel that there's something going on and you might think, hey, it's normal, it should not stop you from also getting tested. So don't maybe kind of self-diagnose yourself out of testing. Testing is available, and you should utilize it if you feel that you have any of those symptoms. Even if you have a history of allergies or other underlying health conditions, which also makes it actually important for you to get tested because it might be, again, covering up COVID symptoms as well.
Well, just so I understand, sorry, if they do show up and they don't have symptoms, you will still test them. If they haven't been sneezing, if they don't have allergies, you will still test them.
Heartland Health Services will still test individuals. Again, understanding that there's more than just symptomology is also understanding if they are one of those priority group areas, healthcare workers, correctional facilities, infrastructure. And again, critical infrastructure includes workers in grocery stores, pharmacies, restaurants, gas stations, public utilities, factories, childcare, and so forth. And so they're not going to necessarily turn individuals away.
So with the expansion of community-based testing in the Peoria area, now anybody with those symptoms can go get tested. Has there also been an increase in demand for contact tracing? Who exactly in this area is doing contact tracing? Do we have enough? Is there a need for more?
It's a great question. Whenever you see increased testing, there's going to be increased positives because people are being found, right? And then with that comes that contact tracing, and that falls on local health departments. So here in Peoria, it's Peoria City County Health Department staff. And I think that's really, I think the mayor alluded to this, is when we're talking about recovery and kind of trying to reopen back up, which I think is, everyone wants to hear that as well. There's going to be that balance that he mentioned. You want to make sure you have the capacity for testing as well as the capacity for trace back and contact tracing, because when you open it up like this, one of the key things that happens is when you identify someone, you want to be able to identify them fast and all their contacts quickly. And so that's going to be the balancing act. And so that falls, that type of disease investigation has always been housed by local health departments. And so here in Peoria, we've brought in staff from other departments to help support that. In other communities up in the Chicago area, they have relied on universities, medical students to help assist with that. We're looking at regional approaches. We even have state assets as well as federal assets to help with some of those long-term care outbreaks in the northern Chicago areas that we've seen. So there are a lot of people working on it, but historically it falls on the local health departments. And as this transitions on and we get expanded testing as well as opening up, it's still going to be the primary role of a health department.
Are the 3 counties that have been coordinating this response, Peoria, CASA, Woodford, this whole time also coordinating on the contact tracing, since there's probably a lot of crossover between testing?
So that's a great question. The Tri-County has been coordinating not only for just how we're doing response efforts and communication, but also for contact tracing. Now, you still will most likely be directly contacted if you're positive by the county that you reside in, because they are able to access information by residents, and jurisdictions kind of lie on that side. But we recognize the fact that if I'm investigating someone that works at a facility, their co-workers work in multiple entities as well. And so we have been sharing that information back and forth with each other, and it's helped us respond quickly in some cases.
So I was wondering, could you just walk me through kind of, so let's say I test positive for COVID-19, how are you going to start the process of contact tracing, and how long does that usually take to figure out who I've been in contact with over the past 2 weeks or however long it is?
So the question is, once someone gets contact tracing, we're going to use you as an example, Tim. How do we find out where he's been? So really the first effort is, depending on how you got tested and where you're currently located, we start with that process. Some individuals are hospitalized, so the hospitals will work with them initially to let them know of their results and also get some of that first feedback. When did your symptoms start? When did you when were you tested? All that information. they supply that to the health department. Now, if you've gone through one of the drive-through clinics, whether it's McLean here or Heartland Health Services, then the health department is actually the initial one that reaches out to you, unless you're a Heartland Health Service patient, and then they would be. We reach out to you and we kind of get the same information, who you've been in contact with, where have you been. Right now, because of the stay-at-home order, this has been really advantageous for us from a tracking and traceback standpoint, because people aren't really out and about a lot. So the number of contacts you are seems to be limited. Whether, think about this time last year, if we were to ask you, can you remember 2 days ago or 3 days ago all the people and where you've been? I'm guessing with the beautiful weather, you were at a park, you might have gone out to eat with friends, you might have done a variety of activities. So being the stay-at-home order has actually helped us from a contact tracing standpoint as well. But then what we'd ask you is where you've been and kind of how long you've been in those areas, what have you done? If it's a brief case of maybe you went and picked up groceries at Walmart, you parked your car, they dropped it in your trunk, Walmart would not necessarily be one of the areas that we would consider. In fact, we would consider their risk the same as if they were in the general community risk. But now you have a roommate or you have a significant other that lives with you, is close contact with you. That's the individual that we would start monitoring and reaching out with. So we'd get their information, their contact information, speak to them, explain to them that, hey, you have been exposed to someone that tested positive, and then work through the process with them. If they're symptomatic, then we ask them to self-isolate immediately as well and talk to their healthcare provider, and if they can, maybe get tested as well. If they're not having symptoms, we're going to still ask them to quarantine, but then they're going to get a survey. And that's the great part, is that technology has saved us in the sense. A lot of people have cell phones and are able to access this. So you get a survey twice a day to ask you to report in your symptoms. We have staff that monitor those surveys to see what people are responding back to, have their symptoms changed. If they forgot to do the survey, they call them and kind of make sure we continue with that. And then we monitor them for the next 14 days. Those are the people we call in quarantine. They don't have symptoms, they don't have a positive test result, we're just monitoring them. And then we'll release them from quarantine. But again, this is a really labor-intensive activity. We're really lucky here that we're able to pull from our environmental health program, which that staff who routinely does food inspections are trained to do inspections, are trained to ask those questions, to dig deeper. And so they're helping support our routine disease investigation staff. Now, when we go back to kind of operating as usual, they have to go back to kind of their daily operations as well. And so really, we're looking for a lot of guidance from the state because, again, this is such a highly contagious virus that tracking and traceback is going to be key in how fast you can reopen, because you want to get people in and investigating within 48 hours, if not sooner.
What is that ratio?
How many total positive results have we gotten through the Heartland clinics now?
I can't speak to Tazewell and Woodford County. I asked them to push that
No, I
forward.
mean, how many positive cases have we gotten through the Heartland testing sites?
So I can't speak to all of those. I just know Peoria's count only. We've got identified 10.
Okay.
Monica,
We've only gotten 10. We've only gotten 10. And how long, have there been delays? Because I had someone contact me and said it took almost a week for them to get their results.
So for positives, there are no delays really. As soon as we get notified, the health departments turn around and the lab is really quickly. I think early on, it was just making sure we had the staffing available. Heartland's partnering with UICOM to make sure they're able to push out those results, the negatives, as fast as possible. So with negatives, I think they've corrected that, and now it's moving really smoothly. Now the 10 I reported to that were positive so far, those are the results that we have up till Friday. We have not gotten I think our Saturday data just came in when I was walking over here, and our Sunday will be in later tomorrow.
So if somebody's tested, they haven't heard about it, that's probably a good sign for them.
If it's a long period of time, I would say yes.
Okay.
It's kind of like with general medical information. You guys always know you wait for a test result, and if you don't hear back immediately, you kind of feel like, oh, okay, it's not on their priority for us to call me back, so maybe that's good news. So, but at the same time, again, when you are waiting for your test results, we do ask you to self-isolate and quarantine until you get that result in hand.
Monica, based off of the mayor's statements earlier, balancing that medical knowledge with the economic, impact as well. In your medical opinion, do you believe that this area of Illinois is ready to start loosening restrictions?
That's a great question in terms of, are we ready to start loosening up restrictions? And I think the key thing is, in this part of Illinois too, those two go hand in hand, because remember, our largest employer is our healthcare systems, right? So you can't talk with one without the other. And so I think it's going to be one, testing capacity. We've had one full week of testing. We're still seeing positives. Again, those are individuals that would not be necessarily in the community. But then our ICU levels and those other measures haven't gone to a point where it's been a burden on our healthcare system. I think the next few weeks are going to be imperative. It's going to be a watching system because as our largest employers, which also happen to be our first responders in terms of COVID, those ICU units, those are going to bring on more and more services and medical procedures. We're going to be monitoring that level really quickly. And so I appreciate where everyone's in. I think if you ask me today, I feel like we are getting a better understanding of what testing is. But I get nervous because of one thing alone, is that our hospitals and our economy is not based on Peoria County alone. It relies on our neighboring counties as well. And so especially our healthcare providers, they see clients as far as Rock Island, Adams County, even down from Springfield as well. And so we have to recognize the fact that I think Peoria City and the County of Peoria have done a great job. What makes us nervous is that we don't control everyone that comes into our communities. And so I think we have to look at the fact that, the more testing we get, the better we get a better understanding of our community. And Peoria was lucky to get 3 test sites operational. I think as more and more test sites come on, we'll get a better understanding. And then from there, we can kind of start looking at those decisions. But I completely agree with the mayor in the sense that, we need to start having these conversations. It's not siloed just public health only, and it's not siloed in just, economics only. And in Peoria, because they're so mirrored by our healthcare systems, being in both lenses of that, it's going to be really a conversation that has to be happen on different levels.
Do you think the ratio of the tests completed at the drive-through sites to the positives that have come back is a good one?
Right now it's about, I think I said 10 out of 69, but overall the number of tests that they've conducted, I think, is over 700 now as well. And so what we're looking for is positivity rates, and that's a number of positives per total tests. And I think that's what we're really wanting to monitor. When we had really specific testing only, our positivity was at times 20%. And again, to give you perspective, that means for every 5 people we tested, 1 was coming back positive. So, but that's also very skewed because we were using our testing very specifically, right, and prioritizing it. With expansion of that, we're going to see that positivity level decrease, hopefully, and then get to a kind of a point where we understand what the normal levels are in our community. And so right now, I'm not expecting to see 100% of all of our tests come back as well. But I am expecting to see positives come back. And remember, these are individuals that are not hospitalized. They're coming because they are healthy enough to drive a car and come through a test site and that have some type of symptoms or in those high-risk groups. And so the fact that we're catching them, even one, is a pretty impressive thing.
Monica, in Woodford County, the numbers haven't changed a whole lot. Do you know how many cases have recovered in Woodford?
So I believe in Woodford, they had 11 confirmed cases to date. 1 passed away. Of their 10, 100% have recovered.
Monica, looking at assisted living facilities, one of the ones in this area, Generations, it's listed on the site as a hot spot, so to speak, but they're only listing 4. Do you know if all of the staff and all of those residents have been tested?
So we have not had 100% testing done on all residents and all staff. And a lot of that also is because long-term care facilities, because of how they are situated in terms of the restrictions, when one is tested positive and they have a suspect, we consider it everyone presumed as well. So depending on if a patient cannot travel, we don't necessarily test them because we'll just presume it at times as well. We are advocating, though, that if you work in a long-term care facility, please do get tested. The drive-through clinics are available. You are one of those 4 groups that's highly prioritized. And again, because we understand that people can have very mild symptoms or asymptomatic, if you're able to, go ahead as staff to get tested.
So when do you think locally all assisted living facilities would become a quote-unquote priority testing, where tests would be shipped just to them?
So the question is when the priority testing to have testing shipped to them. And actually, one of the calls today with our healthcare providers, which include senior leadership from both Unity Point Health and OSF St. Francis, as well as Heartland Health Services, is actually doing the exact same thing. If ability to have people come through the drive-thrus because they're easy and they're open every single day of the week, but also then to get testing out to them so that those that can't necessarily travel from a resident standpoint can also get tested. It's one of the state's priorities as well. Majority of our cases, majority of our mortality is coming from long-term care facilities, so they are a high priority throughout the state.
Monica, when people hear self-administer, sometimes that kind of gets a little, the wording, they get confused. Could you just go through what self-administer means when you're being tested?
So when we talk about getting tested and we say the term self-administered, that means that you are able to complete your consent forms, able to hold still. I always think about, I have young children. My 4-year-old would not be able to get self-administered, meaning that she would wiggle too much. I'd have to hold her to get this test done. And so self-administered is really focused on individuals that can sit still and get the test done, which is, again, is a nasal swab, gets inserted into your nose for about 10 seconds. Well, thank you very much. We will see you guys again tomorrow.